All right, just gonna show the room to make sure there's nothing showing on the ceilings. It's my wife, my patient. This is a made-up Snellen chart that I'm gonna use. Look at the floors. See there. Make sure that I am in view here. Back. All right, gonna get started. So I introduce myself to the patient, wash my hands, and I'm gonna start my exam. So first thing I'm gonna do, I'm gonna inspect the skin of the face and the head, the color, the temperature, the moisture, texture, edema, turgor, bruising, scarring, lesions, or nevi. Inspect the overall size, shape, and symmetry of the head. Next, I'm going to inspect and palpate the scalp, looking at the hair color, distribution, texture, looking for any lesions, any masses, tenderness, depressions, or infestations. Next, I'm going to palpate the temporal arteries for any tenderness. Next, we're going to palpate the lymph nodes, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, moving on to check cranial nerve 5 is the masseter muscle. I want you to clench your jaw. Good. And also checking for sensory. So I'm going to touch the forehead, the chin, the cheeks, and the nose. Let me know if you feel this.
Yes.
And then cranial nerve 7 is checking for symmetry with smiling, frowning, poke your cheeks out, pucker your lips, and raise your eyebrows. Good. Moving on to the ears, check the overall size and shape of the ears, making sure that they are symmetrical. They are. Checking the auditory canal with my otoscope, checking the tympanic membrane. And good. Now we'll be checking cranial nerve 8. So for hearing, first one will be the whisper test.
1, 2, 3, 4, 5, 6.
Then we go into the Weber test. Let me know if you hear this both on the same side or different on the other.
Same.
All right. And then the Rene test. Let me know when you stop hearing it.
Okay.
You still hear it?
Yes.
Okay.
Okay. Yes.
All right. Great. Moving on to the eyes, checking the lashes, the brows, the palpable fissures, inspecting the sclera and the conjunctiva for color, for lesions, for discharge. Next, moving on to cranial nerve 2. I'm gonna hold this 14 inches away from her. I'll have her cover her one eye. Read the lowest line.
TRF-CDR.
Other eye.
TRF-CDR.
And both eyes.
TRF-CDR.
All right. I'm checking for central and peripheral vision. So I want you to tell me when you see it. Look at my nose. Tell me when you see it.
See it? See it? Yes. 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 Yes.
All right. Good. Checking for cranial nerve 3, which is direct and consensual pupillary response to light. I would dim the lights. I would check the pupil for constriction. We do have direct and consensual. And we do have direct and consensual in that eye as well. Checking for accommodation and convergence. I want you to follow my finger all the way into your nose. Good. Now I want you to follow my finger just with your eyes. This is cranial nerve 2, 3, 4, and 6. Extraocular movement. And then I do not have an ophthalmoscope. I would use my otoscope, checking red reflex in both eyes. Good. Now moving on to the nose, I would inspect the nose to make sure it was midline and the correct shape, and it is. Check for nasal patency, sniff. All right, good. Palpate the maxillary sinuses and frontal sinuses for any tenderness. Moving on to the mouth, inspect the lips, the teeth, the gums, the buccal mucosa, looking at the tongue, the soft palate, looking underneath the tongue, looking at the posterior pharynx and the tonsils. I would grade them if they were there, which her tonsils have been removed. Next, I would check TMJ, so open your mouth, for any subluxation, tenderness, or crepitus. Good. Next thing we check was cranial nerve 9 and 10. So I want you to say, open your mouth, say ah.
Ah.
So she does have uvula and soft palate rise with phonation. And then cranial nerve 12, I want you to stick your tongue straight out. And the tongue is midline without fasciculations. Moving on to the neck, I inspect the neck, the color, the temperature, the moisture, turgor edema, texture, bruising, scarring, lesions, or nevi. I would make sure that the palpate the trachea, and it is midline. To palpate the thyroid, I would stand behind the patient, displace it, have her swallow, and swallow. Good. I would then palpate for a carotid pulse. Palpate for carotid pulse. All right. Now I'm going to listen for bruise with the bell of the stethoscope. I'm gonna have her turn her head. Hold your breath. Good. Another way. Hold your breath. Good. Next thing we're going to do is check for range of motion on the neck. So flex down, extend, hyperextend, lateral flexion, and rotation. And then cranial nerve 11, rise your shoulders. Good. I want you to turn around for me. First, I'll inspect the posterior thorax here. I would check the color, the temperature, moisture, texture, edema, turgor, bruising, scarring, lesions, or nevi. I would inspect for any signs of respiratory distress, looking for symmetry, looking for overall warmth of the skin. I would palpate for equal chest rise and fall. Take a deep breath. Good. Now tactile firmitus, so say 99.
99, 99, 99.
Good. Next thing we're going to do is we're going to percuss over intercostal spaces. Next thing I'm going to do is listen with the diaphragm for breath sounds, starting above the scapula and alternating sides. Deep breath. Deep breath. And also checking lateral lung fields. Now we're going to check egophony. So Rachel, I want you to say the letter E.
E, 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 E.
In bronchophony, say 99.
99, 99, 99, 99, 99, 99.
And whisper pectoralis. So I want you to whisper 1, 2, 3. All right, good. Now I'll have you turn around. Inspecting the anterior chest, the color, the temperature, the moisture, texture, edema, turgor, bruising, scarring, lesions, or nevi. Looking for any signs of respiratory distress, looking for symmetry. I would palpate for equal chest rise and fall. And also tactile firmitus, say 99.
99, 99.
Good. I would then auscultate breath sounds anteriorly. All right, good. Now we're moving on to heart sounds. The first thing we're going to do is auscultate both with the bell and the diaphragm. Start with the diaphragm over aortic, which is right at the sternal border, second intercostal space. Pulmonic is left of the sternal border, second intercostal space. Herb's point, third intercostal space, left of the sternal border. Tricuspid is fourth intercostal space, left of the sternal border. And mitral, which is midclavicular line, left side of the chest. Same thing with the bell. Aortic, pulmonic, Herb's point, tricuspid, and mitral. I would then palpate for the point of maximum impulse. Go there, and then I would listen for a full minute at the apex to get a rate and a rhythm. Good. I'll have you lay down now. First thing I'm going to do is I'm going to inspect the anterior chest, inspect for any heaves or lifts, and I'm going to palpate over the auscultation points for any thrills, the aortic, pulmonic, Herb's point, tricuspid, and the mitral. I would then listen again while the patient is laying down with the bell and the diaphragm, aortic, pulmonic, Herb's point, tricuspid, and mitral. Aortic, pulmonic, Herb's point, tricuspid, and mitral. Then I'll have the patient sit at a 30 to 45 degree angle, and we will be checking for JVD. Next, I'll be checking the abdomen, inspect the skin, the color, the temperature, the moisture, texture, edema, turgor, bruising, scarring, lesions, or nevi. First thing we're going to do after that is auscultate for bruise with the bell. First, I'll start with the aorta, which is midline. The renal arteries would be approximately 2 centimeters on either side of the umbilicus. Below the umbilicus, the iliac arteries, and then the femoral arteries. We then auscultate bowel sounds in all 4 quadrants. I will then percuss over all 4 quadrants for tympany or dullness. Next, I will start with palpation of the abdomen, starting in the lower with light palpation, then with deeper palpation. I will then check see if I can palpate the liver on the right upper quadrant, and then also check for the spleen on the left upper quadrant. Good. I'm going to check for CVA tenderness, have my patient sit up. Let me know if this hurts.
No. No.
Okay, good. Now swing around here. We're going to start with the upper extremities. Look at the overall upper extremity joints of the hands, the fingers, looking for the warmth, looking for any edema, the overall color, texture, edema, looking for any redness, swelling, tenderness, deformity, crepitus, nodules, and symmetry. Check for capillary refill in the fingers. Check radial pulses. Now we're going to range of motion in the fingers. I want you to flex down, extend, hyperextend, abduction, adduction, and finger opposition. Good. Next, we're moving on to the wrist. Looking at the wrist, inspecting and palpating for any redness, tenderness, swelling, crepitus, nodules, or symmetry. Check range of motion in the wrist. I want you to flex down, extend, hyperextend, and then we'll have radial inversion, ulnar, and then rotation. Moving on to the elbows, I would inspect the elbows, any redness, swelling, tenderness, deformity, crepitus, and symmetry. I would then have the patient flex elbows, good, extend, and hyperextend. Then right, I want you to push up, pull towards you, good, checking the biceps and triceps, push against me, good. Moving on to the shoulders, I would inspect and palpate the shoulders for any redness, swelling, tenderness, deformities, crepitus, nodules, and symmetry. Next, I would then check for range of motion in the shoulders. So I want you to flex, and then extend, hyperextend, and then one arm do adduction, abduction, inversion, eversion, same arm, other arm, abduction, so adduction, abduction, inversion, eversion. Good. Next, we're going to check. I want you to check. Put your hands like this right here. I want you to pull up against me, and then pull down. Okay, good. Next, we're going to check light touch sensation on the extremities. So I want you to close your eyes. Tell me when I'm touching.
Yes. Yes. Yes.
All right. And we're going to check vibratory sensation at the proximal ulna, the wrist. Feel it?
Mm-hmm. Yes.
Okay. Cerebellar function is next. So I have you do finger opposition, pronation, supination, and then touch my finger with your, over here. Other hand, touch my finger, good. Now we're going to check deep tendon reflexes. First one would be brachioradialis and bicep, tricep, patellar, Achilles, and Babinski. Good. Next thing we're going to do is sternosis and gravesthesia. So I'm going to put something in your hand. Tell me what it is.
A pen.
Okay, other hand. Tell me what it is.
Seashell.
All right. Now I'm going to write a number in your hand. Gravesthesia, tell me what number.
8.
And tell me what number.
9.
All right, moving on to the lower extremities. I would inspect the overall lower extremities, the toes, inspect for any redness, swelling, tenderness, any crepitus, nodules, and for symmetry, I would check a dorsalis pedis on the top of the foot, posterior tibial, dorsalis pedis, and posterior tibial. I would check for capillary refill in the toes, which she has good capillary refill. I would check for overall warmth. I'm checking for any edema in the toes as well. Now we're going to do range of motion in the toes. I want you to flex your toes down, extend, hyperextend, abduction, adduction. Good. Moving on to the ankles, I would inspect the ankles for any redness, swelling, tenderness, deformities, nodules, crepitus, and symmetry. I want to check the overall warmth, look for any edema in the ankles, check range of motion. So I want you to dorsiflex, up, plantar flexion, good, inversion, eversion, and rotation. Now I want you to pull against me, pull up towards the sky, and plantar flexion, push down. She does have 5 out of 5 strength. Moving on to the knees, I want to inspect the knees for any redness, swelling, tenderness, crepitus, nodules, and symmetry. Rachel, I want you to push against me, and pull against me. Good, she does 5 out of 5 strength in the knees. Moving on to inspect the hips, looking at any redness, swelling, tenderness, nodules, crepitus, and symmetry. I want you to push against me or push to the out. Good. Push in. So she has 5 out of 5 strength with abduction and adduction. I'm going to have you now stand up. So we're going to inspect the hips again. I'm looking for symmetry, redness, swelling, tenderness, crepitus, or any nodules in the hips. We're now going to check range of motion in the hips. So let's move up a little bit. So flexion with one, extension, hyperextension, other foot, flexion, extension, hyperextension. So abduction, and then adduction across. Good. Same one, other one. Abduction, other way across. Inversion and eversion. Good. Inversion and eversion. Now we're going to flex the knees. So flex the right knee. Good. Flex the left knee and extend. Extend. Good. Moving on to the spine. We're going to check for normal curvature of the spine. Making sure that everything is midline, and it is. Next, we're going to check range of motion in the spine. So Rachel, I want you to flex over, then extend, hyperextend, lateral flexion, that way, lateral flexion this way, rotation, and rotation this way. Good. Next thing we're going to check is for scoliosis when the patient is flexed. So I'll be checking for scoliosis. No, you stand up. Next thing this test is the Romberg test. So I want to be testing to see her stability when she stands still and closes her eyes. Good. The next test will be a gait test. So Rachel, I want you to walk normally. Good. And then walk in tandem, so heel to toe. And then I want you to stand on one foot, hop in place, and stand on the other foot, hop in place. There is one thing I forgot to do on the lower extremity. I would check for, have a seat for me. I would check for light sensation and touch in the lower extremity. So I want you to tell me if you feel me touching.
Yes. 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 Yes.
And also for vibratory sensation at the medial malleolus. You feel me?
Yes. Yes.
And this concludes my head to toe. Thank you.